Okay, yesterday we were discussing about Edwards syndrome. We have discussed the stigmata or the marks of the disease in Edwards syndrome. So I would just recapitulate it. Those persons who are suffering from this trisomy 18 or Edwards syndrome, they show micronatha, they show microcephaly with occiput, they show low set malformed ears, they suffer from ocular hypertelorism, they show upturned nose, they show cleft palate, they show hair lip, and they show this clenched hands. They also suffer from this cryptorchidism, and they show in webbing between second and third toes, right? So that were some marks of the disease. Now we are today going to discuss about what are the complications associated with this Edwards syndrome. So complications which are mostly associated with this Edwards syndrome are kidney malformations. These persons who suffer from Edwards syndrome, they have malformed kidney. Their kidneys are not structurally normal. They show some kidney abnormalities, right? They also suffer from heart problems. Heart problems. They again show atrioventricular or ventricular septum defects, right? So their heart valves, they may be malfunctioning. They may be malformed, right? They also show omphalocele. Omphalocele. What is this omphalocele? Omphalocele means intestine, intestine, and some body organ, some body organs are protruding out, protruding out through belly button, through belly button. So they mostly suffer from omphalocele. Omphalocele means that some parts of the intestine and some other body organs, they may be bulging out of the abdominal cavity through this belly button. That condition is known as omphalocele. They have esophageal atresia. They also suffer from esophageal atresia. Their esophagus is atrophied. So for that reason, they have feeding problems. They develop feeding problems. They develop feeding problems. They suffer from feeding problems. They also suffer from breathing problems. Breathing problems, right? So these are some complications which are associated with this Edwards syndrome or trisomy 18. Most of the deaths occur due to heart problems. In these patients, most of the deaths occur due to heart problems and breathing problems. They develop sleeping apnea. Most of the infants which are born with this Edwards syndrome, they die while sleeping. They get choked while sleeping because of the problems in their breathing. And most of these kids, they die because of heart problems. And some have severe omphalocele. This severe omphalocele, it can be treated by surgical method. These protruding intestine or body organs, they can be sent back into abdomen by surgical method. It can be treated. But most of the deaths, they occur due to heart problem and breathing problems, right? So these are complications associated with Edwards syndrome. Since it is a genetic disorder, it is caused due to trisomy of chromosome number 18. So it is not mostly, there is no cure for it. However, these problems can be addressed to some extent. It has got a low survival rate. Most of these individuals which are born with this trisomy 18, they die early in the childhood. Very less percentage, 1% may reach to adulthood. Most of them die in the infancy, right? So that is all about Edwards syndrome. After Edwards syndrome, we are going to discuss another trisomy. That is known as trisomy 13. That is known as Patio syndrome. Patio syndrome. Or it is also known as trisomy 13. Why it is known as Patio syndrome? Because it was first described by Dr. Claus Patio. It was first described by Dr. Claus Patio in 1960. That is why it is known as Patio syndrome. So this Patio syndrome, it is a result of trisomy 13. So 13th chromosome is in triplicate condition. 13th chromosome is in triplicate condition. So that causes this syndrome known as Patio syndrome. What are the stigmata? What are the marks of this Patio syndrome? These persons who suffer from Patio syndrome, they are motor and mentally challenged. Mentally challenged. Persons suffering from Patio syndrome have got motor disability. They cannot make the movements properly. Their muscles do not make precise movements, right? So they have walking difficulty. They cannot move properly. And they are mentally challenged. That means they suffer from some sort of mental retardation. They are having mental retardation. They also show polydactyly. Polydactyly. They may have extra fingers and toes in their hands and feet. They may also suffer from microcephaly. Microcephaly. Small head. They may also show microcephaly, a small head. They may also suffer from cleft palate. Cleft palate. Cleft palate. They also suffer from cleft palate, right? And they may also have heart problem. They may also have heart problem. So these are the problems which are associated with Patio syndrome. So this Patio syndrome, it is another form of genetic disorder which is caused due to trisomy of chromosome number 13. The persons who are suffering from Patio syndrome, they are motor and mentally challenged. That means they don't have motor skills. They cannot walk, they cannot write, they cannot eat properly. They are mentally retarded people. They may have polydactyly, they may have extra fingers and extra toes in their hands and feet. They may also suffer from microcephaly, although all these symptoms may not be present together in a single person. But those persons who are diagnosed with trisomy 13, they may have any one of these symptoms. So they may show microcephaly, they may show cleft palate, and they may show heart problem. So these are the problems which are associated with trisomy 13. Similarly, we have got another trisomy. That is trisomy 22nd. Cat eye syndrome. This is known as trisomy 22. So cat eye syndrome, it is caused due to trisomy of chromosome number 22. This cat eye syndrome, it was first reported by Schmidt Fraccaro, in 1965. Cat eye syndrome or trisomy 22, it was first reported by Schmidt Fraccaro in 1965. So what are the marks of the disease? What are the stigmata of the disease? So these persons are characterized by vertical coloboma, coloboma of iris, lens, and palpebral, and palpebral. So these persons, they have got a vertical cut in their iris, in their iris. If this is the eye, in the iris of the eye, they have got a vertical cut. This vertical cut, which is present in the iris, This is known as a coloboma, right? This coloboma may be present in the lens as well. Lens is lying behind the iris. In that lens, there may be the similar type of cut, right? The cut may be also present in on the eyelids. Eyelids are also known as scientifically palpebral. So this cut, it may be also present in the eyelids. So this vertical cut, which is present in the iris, lens, or palpebral, it is known as vertical coloboma. And this vertical coloboma, it resembles with the pupil of the cat. If you might have observed the pupil of a cat, the pupil of a cat is in the form of a vertical cut, like this. So the eyes of this person who has got vertical coloboma, it resembles with the eyes of the cat. That is why we call it as cat eye syndrome, right? So in cat eyes, pupil is vertical in the form of a vertical cut. And those persons who are suffering from this cat eye syndrome, who are suffering from trisomy 22, they also develop a similar type of cut in their iris. So that is why it is known as cat eye syndrome, right? These persons, they may also suffer from kidney malformation, kidney malformation. They may also suffer from heart problems. They may also suffer from anal atresia. They may also suffer from anal atresia. So these persons who are suffering from cat eye syndrome have vertical coloboma of iris, lens, palpebral. In addition to that, they may be suffering from kidney malformations. They may be suffering from heart problems, or they may be suffering from anal atresia. So this is all caused due to trisomy 22nd. So because the eyes resemble with the eyes of the cat, that is why it is commonly known as cat eye syndrome. Then there is another syndrome, another genetic disorder that is known as cry-do-chat. There is another genetic disorder which is known as cry-do-chat syndrome, or it is also known as cat cry syndrome. Cat cry syndrome. It is also known as cat cry syndrome. So this cry-do-chat or cat cry syndrome, it is caused due to deletion of deletion of a segment in P arm of chromosome number 5. If this is chromosome number 5, it has got two arms. This arm is known as P arm, this is known as Q arm. In the P arm, gets a segment deleted. So this is chromosome number 5. It has got two arms. One short arm known as P arm and another long arm known as Q arm. In the P arm, it suffers deletion of this segment. When this segment of the chromosome gets deleted, when it gets cut, when it gets lost, right? So this is known as 5P. You can understand 5 is the chromosome number, P is the P arm, minus syndrome. Minus indicates the deletion. So we call this cry-do-chat or cat cry syndrome also as 5P minus syndrome. Why 5P minus syndrome? Because the chromosome which is involved is chromosome number 5. Chromosome number 5 has got two arms, P arm and Q arm. The deletion occurs in the P arm. That is why we call it as 5P minus syndrome, right? So this cat cry syndrome or cry-do-chat syndrome, it is due to deletion of a segment in the P arm of chromosome number 5. So that is why we call it as 5P minus syndrome. So what are the characteristic features of this cat cry syndrome or cry-do-chat syndrome? Those babies who are born with this cat cry syndrome, they have defects in their larynx and the nervous supply to the larynx, right? So they have defective larynx and defective nerve innervations, innervations to larynx. So their larynx is not functioning properly. So when they weep, when these babies born with this 5P minus syndrome, when they weep, at that time they produce a cry which is resembling with the mewing of a kitten, which resembles with the cry of a kitten, right? So they produce a mewing, kitten-like cry, kitten-like cry. So when these babies who are born with this cradle syndrome, when they start weeping and their cry appears or sounds like the mewing of a kitten, the cry of a kitten. That is why it has been named as cat cry syndrome. So why they produce a kitten-like sound? It is because of the defect in their larynx. So these babies, they have feeding problems as well. They have feeding problems. They cannot swallow the milk or other substances normally. Even they cannot swallow their saliva. We produce saliva in our mouth continuously. Unintentionally, unknowingly, this saliva is being ingested, it is being deglutited, it is being swallowed, right? Because of their defective larynx, they are not able to swallow this saliva. So this saliva flows out of the mouth. So that condition is known as drooling. So they show drooling. They show excessive drooling. Excessive drooling. So their saliva flows out of the mouth, right? So it is all because of the defects in larynx. So in cradle-chat syndrome or cat cry syndrome, a baby is suffering from deletion of a segment of chromosome number 5 in the PR, right? So due to loss of this chromosome segment, the larynx of the baby becomes defective, or the nerve innervation to the larynx that becomes defective. So the larynx is not functioning properly. So when these babies make a cry, their cry resembles with the mewing of the kitten. That is why it has been named as cat cry syndrome, right? So due to defective larynx, they are not able to take anything. They are not able to swallow anything normally. So they have feeding problems. They cannot be fed properly. They are not able to swallow the things, right? They are not even able to swallow their own this saliva. So this saliva, it flows out of the mouth, and this flow of saliva out of the mouth, this is known as drooling. So they show excessive drooling, and they are suffering from low birth weight. They have their body weight is very less at the time of birth, right? So this is the problem which is associated with cry-do-chat syndrome or cat cry syndrome. Then at the last, we discuss another autosomal chromosomal disorder that is known as Philadelphia chromosome. So what is this Philadelphia chromosome? Let us see what is this Philadelphia chromosome, why it has been named as Philadelphia chromosome. Philadelphia chromosome. It was reported by Peter Novel, Peter Novel, and David Hungerford, and David Hungerford in 1960. This Philadelphia chromosome, it was reported by Peter Novel and David Hungerford in 1960 in Philadelphia, America. in Philadelphia, America, right? So that is why it was named as Philadelphia chromosome. So what is special about this Philadelphia chromosome? This Philadelphia chromosome, it is characterized by reciprocal translocation. Reciprocal translocation. It is caused due to reciprocal translocation between chromosome number chromosome number 9 and 22. So it is designated as T922. So what does it mean? A part of chromosome number 9 and a part of chromosome number 22. This is chromosome number 9, this is chromosome number 22. A part of this chromosome, it breaks. A part of this chromosome, chromosome number 9 breaks, it gets cut, and it joins with the part of chromosome number, it joins with the chromosome number 22. And the part of chromosome number 22 gets cut and it joins with the chromosome number 9. So its segment joins with this and its segment joins with this, right? So there is reciprocal translocation. Both the chromosomes suffer deletion at first. Both the chromosomes, they get a part of them cut. Then those cut parts, they are exchanged between chromosome number 9 and chromosome number 22. So part of chromosome number 22 joins with the chromosome number 9 and part of chromosome number 9 joins with the chromosome number 22. So we designate it as T922. So there is reciprocal translocation. It gives a part to this chromosome and this chromosome gives a part to this chromosome. So there is reciprocal translocation. So this is written as T922. So these persons, they are prone to chronic myelogenous leukemia. Leukemia. So these persons, they suffer from a type of blood cancer. They suffer from a type of blood cancer. And this blood cancer, it is caused due to this reciprocal translocation between reciprocal exchange, mutual exchange of gene segments between chromosome number 9 and chromosome number 22. So this mutual exchange of gene segments, it leads to a type of blood cancer known as chronic myelogenous leukemia. And this is the characteristic feature of this Philadelphia chromosome. So this Philadelphia chromosome, it was found first, it was discovered first by Peter Novel and David Hungerford in a person in Philadelphia, America. That is why it had been named as Philadelphia chromosome. And it was ascertained that this Philadelphia chromosome, it gives rise to chronic myelogenous leukemia. So these persons are prone to blood cancer, right? So that is all about autosomal chromosomal disorders, right? I think this is sufficient for today. Okay, thank you for being with me.